Everyone, welcome to chapter 16. I'm going to go into our share screen here. All right, so exercise prescriptions for health and fitness. What are we doing? Why are we doing it? All right, so if we're looking at this, any physical activity is going to be a form of muscular activity. We know that being physically active can reduce our risk of death from basically all causes. And we know that physical inactivity is a primary risk factor for coronary heart disease. If we were to define physical fitness, it's going to be a set of attributes that relate to the ability to perform physical activity. Right? What do we have? What do we have to work with? Exercise is going to be a subset of physical activity that is planned with a goal of improving or maintaining fitness. I consider this to be a definition that I go over a lot with patients, especially when I'm treating a workman's comp population. You know, they're like, but I went to work today. It's all right, but work is repetitive. Work is the same thing, and work is not exercise. So the important part of that definition, it is physical activity that is planned, and its only goal is to improve or maintain fitness. So we have to look at dose-response relationships. The effect, the response of the amount of a drug or a dose. So let's look at some subsets of this. So potency. It's a relatively unimportant characteristic. The slope is going to be how much of a change in effect comes from a change in dose. If we look at maximal effort, what is the efficacy of that? Variability. We have to look at the effects between or within the individual. And a side effect is going to be an adverse effect. Right? So if we look at that, the drug, that's what we're looking for. So we're going to see the intensity of effect is going to increase with maximal effort. What does that slope look like? What is our variability? How potent, what kind of actual result do we see? When we look at the dose response for exercise, we have to look at the frequency, the intensity, the time, and the type. Okay, so the frequency is going to be how many times a week or how many times per day. The intensity, are we going to do this based on lactate threshold or a percent of VO2 max, a percentage of maximal heart rate? Are we looking at the RPE scale? What kind of intensity are we looking at? Time, how many minutes of exercise? And the type, are we doing resistance? Are we doing cardiovascular endurance? Are we swimming, biking, rowing, etc.? If we're looking at our response to exercise, are we looking for specific changes regarding VO2 max? Are we looking for health-related changes? When we look at this, we need the FIT VP principle, all right? What is our frequency? What is our intensity? What is our time? What is our type? Then we have to look at the volume, which will be all of those together, the frequency, intensity, times time, and a progression. Do we go from easier to harder exercises? When we start looking at patterns of response to exercise, we have to look at acute response. They can occur with one or several bouts, but don't necessarily see any further improvement, right? So it's going to be an acute response. A rapid response, you're going to see benefits occur early, but then they may plateau. You're going to see linear gains made continuously over time, a steady increase. Delayed, we might see benefits, but those benefits don't show up until after weeks of training. So what are we looking at? The ASTM CDC recommendations in 1995, where every adult should accumulate 30 minutes or more of moderate intensity, 3 to 6 MET of physical activity on most, preferably all days of the week. All right, so let's go on. And 12 years later, they they redo it. What are they recommending in 2007? To promote and maintain health. All healthy individuals aged 18 to 65 need moderate intensity aerobic endurance, PE, for a minimum of 30 minutes on 5 days each week, or vigorous intensity aerobic physical activity for a minimum of 20 minutes on 3 days a week. That recommendation included resistance training of 8 to 10 exercises, 8 to 12 reps on 2 or more non-consecutive days per week. In 2008, they updated a little bit more. Individuals can realize the health-related benefits of physical activity by doing between 130 and 300 minutes of moderate intensity physical activity per week, or 75 to 150 minutes of vigorous intensity physical activity per week, or some combination of the two. So what did that look at doing? 150 minutes of moderate intensity activity or 75 minutes of vigorous is the minimum goal. That's an important thing. We looked at that criterion. What's the minimal level we can see as being beneficial? That's what this recommendation is saying. The range of physical activity, that 150 to 300 minutes, indicates that more health-related benefits are realized by doing additional activity. That old saying, more is better, incredibly true. We'd also do physical activity and multiple bouts, 10 minutes each time to meet the goal. So what we want to look at is that dose-response relationship. So over time, doing exercises, you can see the effect on cholesterol levels is really not going to show up until you're at 210 minutes per week of exercise, where you're going to see that insulin sensitivity improve with maximal effort, but not as much time, all right? So all of those things are going to play a role in what we're trying to change. It gives us an idea of what we should do. So what does regular participation in physical activity associate with? Lower causes of all mortality, all right? Increased weight loss, reduced weight gain. You'll see a lower incidence of obesity, type 2 diabetes, metabolic syndromes. It's going to help lower the risk for both colon and breast cancer. It's going to improve our ability to complete activities of daily living and reduce the risk of falls. We're going to see a reduction in depression and cognitive decline. And we're going to see improvements in cardiovascular disease risk factors. So PE being active in health, the volume of activity is going to be our most important variable linked to our health. You're going to see the risk of chronic diseases reduced almost 20 to 40%. Again, the greatest gains are in those who went from no activity to some activity. Again, if the bar is extremely low, we have nothing to do but go up. Even if the recommendations are not met, anything is better than nothing. And the more active, better the health outcome. You have to balance that by adverse outcomes with too much activity, i.e., you can have some repetitive bone stress syndromes occur if you're doing too much or you have poor form. So for the most part, it's safe to say that more activity is better. Just don't beat yourself up too much. Is vigorous exercise better than moderate? We are going to see the vigorous intensity activity was associated with a reduce in the risk of coronary heart disease compared to lower intensities. It was also more beneficial for altering those risk factors. Higher intensity physical activity also had less sick leave. So yes, it's saying that vigorous is better than moderate for the most part. But you also have to look at anything is better than nothing. And that moderate activity truly may be considered very vigorous for anyone who's deconditioned. So if we start looking at this relative exercise intensity based on capacity, we're looking at that percent of VO2 max, how hard we're working, right? And we're looking at that exercise capabilities in terms of METs, all right? Those metabolic equivalents. So when you look at a treadmill, a MET, there might be a chart there depending on what intensity you're working at. You might see that that is in fact related. So you can see if we're working too hard, we're kind of exceed capacity. And that's going to be maximal in intensity, all right? So just keep in mind how we look at that. So for improving fitness, moderate physical activity results in reducing health-related problems. The risk of moderate activity is very low. We may see a higher risk of cardiac arrest in vigorous activity, more so in men than women. There is a higher risk during exercise, but if we look at it, there's a lower overall risk when compared to being sedentary. So even though there's a higher risk during exercise for vigorous activity, not doing the vigorous activity may actually just have a higher risk in itself because of the inactivity. So if we look at, normal subjects here and relative risk of death, you're going to see those lower METs are going to be here. Oh, I messed up. So you're going to see that as the exercise capacity increases, you're going to see that relative risk of death is usually always higher in those with cardiovascular disease. So how do we look at this? We screen them. So we have to look at the risk of cardiovascular complication related to those pre-existing cardiac diseases. Our progression is start light to moderate, and then increase your duration and or intensity. So you start with a walk, and then you go to a walk/jog, and then you go to a jog. There's going to be a general rule of thumb that says to increase about 10% per week. There's really very little to no data that suggests that a 10% increase is the answer. However, it doesn't seem like a grossly out of place assumption. So, some trainers will tell coaches you can only increase mileage by 10%. Depends on the person, depends on the individual, but as an overall rule of thumb, doesn't feel like it's too far off. So we need to consider that we have to have a warm up, a stretch and a cool down and a stretch. We want to do some light exercise and stretching at the beginning and end of each bout of exercise. When we're looking at an exercise prescription, we're looking at dynamic, large muscle groups, walking, jogging, running, swimming, cycling, rowing, dancing, all right? We want to do whole body stuff. The ASDM recommendations are 3 to 5 sessions a week, 20 to 60 minutes per session, intensities of 40 to almost 90% of heart rate reserve. If we're looking at moderate activity, it'll be that 40 to 60% range. Vigorous is going to be over 60. You should have a total end of 500 to 1,000 METs per minute per week. How many MET minutes you're able to achieve in that week. They want more than 5 days a week for moderate intensity exercise. They want more than 3 days a week for vigorous intensity exercise. I'm going to tell you what's a minimum of 2 days a week. We might not see as many gains after 3 to 4 sessions in a week. We might see higher frequencies associated with increased risk of injury, and that's going to be looking at that vigorous intensity of exercise. All right, so vigorous every day is not necessarily going to be our best choice. So here's a pictorial to look at it, and you can see that optimal training intensity is going to be in that 60 to 80% VO2 max range. You're going to see in that 3 to 4 days a week with a duration of 20 to 30 minutes. If we're looking at orthopedic risk and cardiac complications, the higher intensity between that 80 and 100%, and more days per week and more minutes, that's when we're going to start to see breakdown. Intensity, what is the overall overload needed to bring about a training effect? So we know that the cardiovascular risk factors are going to improve at that 60 to, it's going to be your cardio respiratory fitness improvements are going to be at 60 to 80% of our VO2 max. Again, you start the bar lower, you're going to see those numbers being lower if you are starting from a very low fitness level. We can use a target heart rate range to help prescribe how hard people should be working when doing the exercise. How do we look at target heart range? Direct method is based on the results of your graded exercise test, and you want to be at 60 to 80% of that VO2 max. Indirectly, we can look at that heart rate reserve. So we want to look at your resting heart rate from the maximum heart rate to obtain that heart rate reserve. So if we look at 220 minus age, we're going to work at 60 to 80% of that heart rate reserve. And we have to add that heart rate reserve back to the resting to give us our target heart rate range. We can look at a percentage of maximal heart rate. So we can work between 70 and 85% of that maximum heart rate as a target range, like the 220 minus age. And we could use the RPE scale in addition to heart rate. So RPE of 12 to 17 is working at about 40 to 89% of heart rate reserve. So that might be something that if they understand how to use the scale and they concern themselves with nothing else, they're going to know that they're in that somewhat hard to hard range. So if we look at it from the graded exercise test, we can drop down what the heart rate was to be at that 80% of VO2 max versus 60% VO2 max. And it'll give us a range here, 138 to 164 beats per minute. We have to look at the time considered with intensity. If we're not working very hard, then we have to work a lot longer. So we're going to see, especially in the sedentary individuals, we can do longer duration exercise, but the intensity also has to be lower. So I put here in red our optimal characteristics. 60 to 80% of VO2 max, 3 to 4 times a week, and you need to be able to expend between 200 and 300 kcals. The target heart rate, take it as 60 to 80% of heart rate reserve or 70 to 85% of max heart rate, is a reasonable estimate on the exercise intensity. So sequence, start with walking. If we're sedentary, start walking. Go comfortably for 15 minutes. Start to go a little faster, go longer. A transition to jogging, start by adding some running when walking. If I was looking at sports and an injured athlete, a lot of the more acceptable means of returning to running might be you jog for 1 minute, walk for 5. Do that for 3 days. Then jog for 2, walk for 4. Do that for 3 days. 3 to 3. Keep changing the ratio until eventually you're able to run. Another thing that you might look at doing is jog, especially for somebody really deconditioned. Do 20 steps. Jog, walk 20 steps. And just keep going back and forth in those intervals until we're able to progress to more consistent ability to walk. games and sports are going to have intermittent higher intensity activities within that target heart rate range. You know, you might be playing soccer, you might be a defensive back who doesn't have to do a ton of movement when your team's on offense. So just keep that in mind, what's happening. So here's just another example of a walking and jogging program. You know, there's so many steps, the walking, as far as a progression goes. When we look at muscle strength and flexibility, they're going to be components of a complete fitness program. You know, we need both. We need to increase, we need to maintain our strength, and they themselves will have their own additional health benefits. The ASCM recommendation are dynamic and done routinely. So what are the benefits of resistance training? We're going to see a decrease in total body fat. We're going to see an improvement in the lean body mass. You will see changes and improvements in metabolic rate at rest, meaning it costs your system far more to maintain muscle than it does fat. We're going to see huge improvements in strength and muscle mass, power. We're going to see improvements in insulin sensitivity. All of those are going to positively affect exercise. So when we look at strength training, what are the ACSM recommendations? One set of 8 to 10 exercises so that we globally get all of the major muscle groups. We're doing 8 to 12 reps per set, and we're doing 2 to 3 sessions per week. If we're looking at a goal of improving strength, multiple sets are more effective. When we're just trying to be active and do something, a single set is sufficient. But we're always going to choose, if possible, to do multiple. For maximum gains in strength, you are looking at an untrained athlete. 4 sets at 60% of your 1 rep max, 3 days a week. And a trained individual, 4 sets at 80% of your 1 RM, 2 days a week. And athletes, you look at 8 sets of 80% of 1 RM, 2 days per week to improve maximal strength, right? So I put a star on that and come back to it, because when you write your exercise prescription, you need to justify what you're doing and why you're doing it. And a lot of that's going to depend on your goal. It's going to depend on where you started from and what we're looking at trying to see. So if we have somebody untrained, you know, we might do 60 to 70% of that 1 rep max. For 8 to 12 reps, we might do 1 to 3 sets, put 2 to 3 minutes between each, and do it 2 to 3 days a week. After 6 months of training, we might be looking at multiple sets. We may be looking at 3 to 5 minutes of rest between sets, 3 to 4 days a week. And the reason why we'd want more rest between them is because at that point, our 1 rep max should have improved and we should be lifting heavier. After years of training, we're going to work at between that 80 and 100% of 1 rep max, multiple sets, all right, 4 to 6 days a week. You know, concerns environmentally, heart rate can be affected by heat and humidity. We can also affect it at altitude. So we might have to adjust our exercise intensities in those adverse environments. We might use the target heart rate range more as a guide for intensity if we're maxing out where we wouldn't and everything we're doing effort-wise is lower than usual, but our heart rate is hovering at the high end of our range. That has to be an indicator that we need to back off the activity. Exercising cold is typically safe as long as we're dressed appropriately. That gives you an idea on just some of the differences that we need to consider when looking at our exercise prescriptions. So we'll get into some strength stuff later, and might actually be in the next chapter. We'll have some videos so that you have an idea how to assess yourself for that 1 rep max.